Welcome to the Energy Forum, where we explore the key issues shaping energy markets and policies. I'm Ken Medlock, Senior Director at the Center for Energy Studies at the Baker Institute for Public Policy. Today, we're diving into a crucial but often overlooked topic, medical plastic waste. The healthcare industry generates a significant amount of plastic waste, yet only a small fraction is recovered and recycled. Leading the conversation is our very own Rachel Meidl, Fellow in Energy and Sustainability and Deputy Director of the Center for Energy Studies. Rachel is joined by Linette Leadon, Director of Environmental Health and Safety at MD Anderson. Together, they'll discuss the complexities of medical plastic waste and how we can transition to a more sustainable future. Rachel, take it away.
Thanks, Ken, for the introduction, and welcome, Linette. Thanks for joining us today.
Thanks for having me today.
Sure. And so for those of you tuning in, Linette Leadon is at MD Anderson. And Linette, you have shaped and informed policies and practices across healthcare systems. And like me, we're both very interested in the state of plastic waste and waste in general. Mine stems from a different background of managing hazardous waste earlier in my career, but we both seem to have backgrounds in environment, health, and safety. So how did you become interested in plastic waste within the medical and healthcare industry?
By trade, I'm an industrial hygienist. For those of you who may not know, my whole career has been built on safety and the environment and how we protect our community, our people, and the precious resources we have access to. So for me, about 10 years ago, I was asked to help lead a sustainability committee at MD Anderson. And leading that committee opened my eyes to so many opportunities for us to reduce waste and care for our environment in a better way, while I still have to keep in mind the need to provide excellent patient care.
At what point in time did the environment, health, and safety efforts to reduce and recycle medical and healthcare plastic waste, like when did that become a critical element of the program as opposed to just managing waste in general?
Great question. So MD Anderson has been recycling for more than 20 years. Our recycling efforts have mainly been focused on single stream recycling, paper, certain plastics, metals, those types of things. But as we have evolved and moved to a more fast-paced and disposable environment, the need to recycle plastics in healthcare has become a more pressing issue.
Talk to us about why plastics is such a dominant material in healthcare. A lot of people, when they go to the doctor, they see a lot of packaging used within different procedures. And so there's a role there when it comes to infection control, safety, and things like that. But talk to us about why it's such a dominant material. Why is it used so often and so frequently?
So in the hospital environment, plastics can be found in our single-use medical devices. It's found in personal protective equipment, what we call PPE. It's also found as a part of sterile packaging. That packaging is important because it protects our products from contamination. It's also found in syringes, catheters, and most people, the IV bags that are used for therapies and the tubing associated with it. And a lot of our respiratory equipment that provides support, such as ventilation tubes, are also made of plastic. And medical plastics are important because they are sterile, no one's used them before, and they are also biocompatible. So that makes them a very easy product to use. They are also disposable, right? So you don't have to worry about the costs associated with reprocessing those materials. It also helps support patient care by being rapidly available. It's easy to grab, it's right there. You don't have to wait for someone to bring it to you. So having that around makes patient care move a lot faster and increases the trust in the product.
And it's affordable, right? It's an affordable product and easily accessible, and it's just durability. And so which is why it's used in a variety of applications all across the medical and healthcare sector. What about the rise of single-use plastics? Talk to us about that during COVID, during the pandemic.
Oh, definitely. So during the pandemic, we had several issues, one being supply chain, right? So people were rapidly trying to put out products that would support infection control. Secondly, infection control. We wanted to make sure we were not passing on any communicable diseases to others. So we were staying away from work. So if you stay away from work, then you don't have those people who are available to reprocess instruments. Moving to plastics was a very, very important practice during the pandemic. And if you remember, we also had issues with people coming to work. So then how are we going to get products in real time, right? So there was a lot of stocking of products so that if you had delays in deliveries, you had something on hand to use while you waited for your next delivery.
Yeah, and with the rise of single-use plastics during the pandemic, that also meant that there's a rise in enormous volumes of waste. And so so this is an estimate that the Healthcare Plastic Recycling Council has, and they estimate that by the end of this year, 2025, that over 48 billion pounds of healthcare plastics will be produced worldwide. And despite the majority of healthcare plastics being uncontaminated and recyclable, that almost 100% is landfilled or incinerated. That's a staggering figure and a lost opportunity for recapturing value. Talk to us about how healthcare systems currently manage waste, I guess, and it doesn't have to be plastic waste, but the variety of different waste. Like, how is MD Anderson managing waste?
So I'll start with our solid or municipal waste. We manage that through a third-party vendor. And you are correct. Hospitals generate large volumes of waste, whether that's plastic waste or municipal waste or even recyclable items. We manage a majority of that through third-party vendors. But what I want to share about plastics is there are a lot of different types of plastics used in medical care. And of those plastics, you have PVC, you have polypropylene, you have PETG, you have polycarbonate. And a lot of those plastics need to be segregated if you're going to recycle them, right? Certain companies or vendors are looking for certain plastics. That presents a huge problem usually in the healthcare industry. It produces a problem because the primary responsibility of our healthcare workers is what? To care for the patient. So it's difficult at times to manage the segregation of all these different types of plastics. And you mentioned some being clean, some being unclean. That's also presents another challenge, right? Because there are regulations that drive how we can dispose of items that are potentially contaminated with infectious material and or blood products. The other thing that I want to cover with our healthcare workers and our buildings and hospitals is we have a lot of space constraints, right? So if segregation is one of the major ways that we can impact recycling and improve our impact to the environment, we need space. We need space to have the appropriate containers for each type of waste or plastics that are going to be disposed of. Beyond the space constraints, we have to trust our healthcare workers to segregate the material properly. In their efforts to care for patients, sometimes that's not most important on the forefront of their minds. So repeated training over and over to make sure that they understand the benefit, understand where these items should go. And I don't know if you know, but oftentimes if the wrong item ends up in a recycle bin, then often that entire bin is going to be placed in the trash and head to the landfill.
Right.
It's too much of an effort to try to recover that item from the recycling, especially if it's infectious, especially if it's contaminating other products inside.
Well, so one thing I want to go back on, I mean, it's interesting. And so you're saying that not only do you have to, the healthcare workers have to segregate by the different chemistries of plastics, there's also different categories of plastic waste. And so there's enormous, I would think there'd be enormous training that would be involved in that. And I'm just thinking about my background in managing waste in hospitals. You mentioned the municipal solid waste, but then you also have hazardous waste, right? And that can be broken down into things like chemical hazardous waste. And then you might have biohazardous waste. and infectious waste, and the regulated medical waste and chemotherapy waste, which is a kind of a subset of the categories, and they're all managed differently, right? They all have different regulatory requirements associated with that. And so how much of a challenge is that? Because this goes back to training the workers, right? To get them to the right behavior in order to segregate them properly, not just by plastic category, but by the regulatory requirements, which are pretty extensive.
Yes, I would agree with you. If you consider medical grade plastics, we often use a majority of those plastics in our operating rooms and in our intensive care units. Just to share, in any one operating room, you could have up to 10 different types of containers to capture all the types of waste that may be leaving that facility. So it becomes increasingly difficult to ensure that our healthcare workers understand the use of each container. And what I'll share is at MD Anderson, we've developed training, right? We've developed training with photos of those containers that gives you videos on how to use the containers, but we also have to consider time it takes to take the training, right? Healthcare workers have a lot of demands on them. So at best, they get that training once a year. If you're not using all those containers frequently, then sometimes it may be a little bit challenging to remember which container to dispose of which item in.
Yeah, that is, I think training is one of the aspects that is always the most difficult when you have complexity of materials and complexity of regulations. And so there's another statistic that shows that there's a growing market for recycled plastics, and we know that. I mean, working in plastics, even outside of medical and healthcare, there is a desire for getting higher recycling rates, for encouraging a more circular economy in plastics. And so 85% of the plastics that come out of a hospital is clean and not contaminated, but even that is still incinerated, even though maybe like 15% of that is considered biohazardous or falls into one of these other categories that we mentioned. And so what are the key barriers to preventing these healthcare plastics from being reused or recycled at a higher rate? And you mentioned that space is an issue, and that's understandable. I mean, hospitals have a smaller footprint, and for the wide range of categories that are there that requiring segregation, it's just not feasible oftentimes. And so what are some of the other key strategies that could help improve recovery rates for plastics in the hospitals?
One key strategy that we at MD Anderson are trying to explore, or we're exploring and piloting, is bringing in the containers at the beginning of a case or a beginning of a procedure and removing them before the procedure begins. So that will help tremendously with segregating the clean plastics from those that become contaminated with hazardous chemicals or with blood-borne pathogens. And it will reduce the amount of containers still in the space during the procedure. So we're really excited to be piloting this project where we understand and bring in containers before the procedure. Those containers allow the healthcare workers and technicians to open all the packaging. Because remember, I said a lot of it can be the sterile packaging. Open the packaging. Also to remove any items from the packaging that won't be needed for that procedure or during that case, and put them in the recycle bin that's only there to set up the case.
Are these considered pre-patient contact plastics, like
Yes.
uncontaminated plastics? Okay.
Yes, these are considered uncontaminated plastics, some new, never been used, but can easily be placed in the correct bin before the procedure starts. That's also important to do it before the procedure starts, because once the procedure begins, the focus then moves, of course, to that patient that's in the space. So if we bring in the appropriate containers before the procedure, give our healthcare workers and technicians time to set up the procedure room properly and dispose of those clean items that are uncontaminated into the proper bins and move those bins out of the space. That also prevents secondary contamination after the case begins.
So we talked about contamination as a potential hurdle in getting a more circular economy for plastics. We talked about the complexity of the plastics, the various chemistries of plastics, various regulatory categories of that. And so there's barriers associated with that. High recycling costs are oftentimes a barrier as well, perhaps limited markets for the recycled plastics. But the other thing that you and I have talked about before is that, like, this whole ick factor and the negative social stigma of healthcare plastics and medical plastics. Is that a real barrier that you're faced with in your role? I mean, how do you overcome that negative stigma of plastics that are going to be recycled, plastics that may have come in contact with patients?
So that is a real barrier. Most people, if they see IV tubing in any trash bag, they're immediately going to think bloodborne pathogens, it's contaminated, it's touched someone. And what we have to do is, there's a real need in industry to be able to bring these items to a level where they're no longer contaminated, and or to reduce that stigma. We as healthcare providers and workers have to maintain that segregation. If it's at this point, if it's contaminated, it has to be removed from that waste stream and placed in a separate waste stream. And I think that for the protection of everyone, we really have to consider doing that until methods and technology is available that's going to remove that contamination to a level that's acceptable.
You had mentioned that sometimes if plastics goes into a wrong container, a container that it's not supposed to go into, that it'll immediately just get sent to the trash, right? Or the, landfill or incineration. Are there regulatory changes or advancements that are needed in order to get some of these contaminated plastics or plastics that might be classified as hazardous waste back into a stream where it could create value, where we could recapture that material value and get higher circularity? So for example, there's many different types of hazardous waste that even if the container is empty, that it still has to be incinerated. And so, like, what's needed in order to get those materials so you can get higher volumes of materials to help support greater feedstock that can be recycled?
Data is needed. Lots of data is needed to demonstrate that those items may no longer be contaminated, right? So would rinsing be effective? Have we studied that? Have we collected data on that? Or is the empty container in its state safe? And is it okay for someone to handle it, given that that product is no longer in it? I think a major part of that is research, data, and then providing that data to our policy generators and those that make the rules and laws so that they can understand clearly where the hazards and potential exposures still exist. Because ultimately, as a safety professional, that's where I'm going, right? I want to make sure that anybody who comes in contact with this item, once it leaves our facility, can be assured that it's safe for them to handle.
Yeah, absolutely. Safety is utmost importance, especially when dealing with medical and hazardous waste. And we need, yes, we need policies to keep up with technologies and innovations. We need investments in new technologies across the entire life cycle. Are there opportunities where we could invest in technologies to help reduce contamination on site, or once it's collected to where it goes to a facility that can manage the waste levels or contamination to a point where it's inert material that could then be fed to recyclers?
So I would venture to say yes. What I venture to say most though is, for it to be on site at a healthcare facility, we're back to the space constraints. We're back to managing specific skill sets. So optimally for a healthcare industry, it would be that other entities, governments, investment companies support building these facilities that can manage our waste and manage it in a way that you can create a new product and you can ensure that no one's going to be injured or harmed being exposed to this product. So while some healthcare facilities would consider doing it on site, I think that you're going to really get support from healthcare industries if those facilities are able to, one, pick it up from the hospital and transport it to another place so that there's not another need for additional space on site at a hospital. You also want to consider that hospitals are meant to be healing environments, and we want to make sure that we are not introducing anything that would prevent or reduce the amount of healing that happens in that environment. So I would really recommend, and I think most healthcare workers would recommend, that we do that in a space that's designed for that, an industrial type space.
And so, I mean, I would think then, given what you said, partnerships are key to this, right? Because you can't do it alone. And it's going to require partnerships and collaboration with the material management sector and perhaps even the petrochemical industry that could take some of this as feedstock in advanced recycling technologies.
Yes, that's some of the excitement that's happening right now. Is some of these petrochemical companies are saying, how can we take what we've made for you, right, and turn it back into raw materials so we can make more of it? And that's the idea. And all healthcare industries that I know of are in support of this circular economy and this process because, one, it helps us by being more friendly to the environment. Two, it probably drives the cost down, right? If we're taking these materials and returning them to their original raw state to be used again, then that's less generation of raw materials. So I think that there's a win-win there with all of those partnerships.
Yeah, absolutely. I mean, partnering with these companies, waste disposal companies, I mean, it allows them to collect and sterilize and recycle these materials and a lot of the materials, especially the pre-patient contact ones that you talked about, Linette, are homogeneous materials, right? And so they are well suited for recycling. They have high purity, they have few additives, very few colorants. So those are great opportunities to recreate value for those materials.
Yes, and I think that we also have an enormous responsibility as a healthcare industry to be mindful of purchasing what we need. But to support purchasing what we need, we also need support from supply chain, right? To make sure that we have the product available when we need it. So that's really important as well, because when we talk about circular economy, it's not just recycling what we've used and turning it back into raw material, but it's also making sure we're mindful to reduce and only use what we need.
That is an awesome point that I make all the time, that a circular economy is not just about recycling, but it's tapping into the entire supply chain, the entire life cycle, all the way from redesigning and re-engineering materials, using less, sharing models, product as a service models. And so it's all of those things taken together. And for it to work best, how it's optimized is when supply chains, when people across the entire supply chain work together, and that's what creates value. As we wrap up, what are some actionable steps that hospitals or policymakers or industry leaders can take today to move forward to a more sustainable healthcare system?
Thanks for asking that. I think to round this out, I think what we all need to do is become more engaged, increase our learning, share our knowledge with others, bring together industries that usually may not work together, right? Because I think there are solutions and innovations in all of those areas. We also need to empower our healthcare workers to think beyond what they're doing at the moment, right? Because if there are products that are new, unused, is there a place where they can be used in another purpose, right? Can this material now become raw material for someone else? You know, we've always said before, one man's trash is another man's treasure. So I think we need to explore how we invest in our people and innovation and technology to really move the needle in that area.
Great points, Lynette, and I want to thank you for your time today, and we appreciate your expertise and your insights. And so thank you so much, Lynette, for joining us today.
Thank you. It's been my pleasure.
The Energy Forum is brought to you by the Center for Energy Studies at the Baker Institute for Public Policy at Rice University. This episode was produced by Maram Hijazi. AV production was led by Kevin Young. Be sure to visit us at bakerinstitute.org/center-energy-studies to learn more. Thanks for listening.